They work full-time, yet spend the night huddled in freezing cars. Children are not in school not because they are sick, but because they have no place to call home. This is not a sci-fi movie. This is reality in Michigan, 2024. Once a symbol of America's industrial spirit and resilience after the crisis, Michigan is now quietly falling into decline. The streets, once covered in snow and filled with history, are now dilapidated, filled with makeshift tents, old shopping carts, and the cold sounds of lives struggling to survive. In cities like Detroit, Flint, and Grand Rapids, homelessness is no longer hidden. It's everywhere under bridges, behind gas stations, and on icy sidewalks. In this episode of our Experience videos, our channel doesn't stop at beautiful lakeside scenes or tree-lined highways. We invite you to step into the dark side of the picture where the silent crisis is unfolding every day, where many people still deliberately turn a blind eye. Because this is not just a story about poverty. It is also a burning question about whether the American dream still has a place for the people who helped build it. Join us as we delve deeper into what is being left out. Current state of homelessness in Michigan. January 2024. More than 8,000 homeless people are roaming the state of Michigan, the highest number in nearly a decade. Half of them live in Detroit. The Cass Corridor, the Ambassador Bridge, and abandoned lots once promised for redevelopment are now home to thousands. In Grand Rapids, nearly 900 people are sheltering on sidewalks or in emergency shelters. Flint and Lansing each have more than 600, all surviving each winter night by clinging to the frailties of humanity. What would make a family with a young child sleep in a beat-up old truck? Why would a decorated veteran cower under a blanket under an overpass? These are not dramatic questions. They are stark slices of real life. As our cameras captured these images, one thing became clear. This crisis could no longer be ignored. Across the city, outreach workers from nonprofits like Streetlight Outreach are racing against the heat. Michigan's winters are unforgiving from December to February. Temperatures regularly drop below zero. In the past 3 years, at least 9 homeless people have died from exposure in Detroit alone. Every one of those deaths was preventable, said James Carter, the organization's director. But shelters are full, and many people are afraid to go in because of the risk of being robbed, or because they're missing out. If you're watching this, please like, comment, or subscribe. Not to amplify statistics, but to keep real stories like this from being buried in silence. Although hot meals and blankets are being distributed regularly by volunteer groups and faith-based organizations, the scale of the crisis has outpaced what they can do. Many shelters have only about 200 beds, a small number compared to the hundreds of people who need a roof over their heads. Children are forced to drop out of school as they move between vehicles or live with relatives in cramped apartments. Elderly people living on fixed pensions are now unable to afford even a basic one-bedroom apartment. Every frame of this film brings you directly into contact with the real people behind the numbers. From the once-suited worker who lost everything to a medical emergency, to the young adults who are no longer in foster care, who are just entering adulthood but have nowhere else to go. An estimated 30% of Michigan's homeless are under 25, and nearly 20% are veterans who have served this country. Michigan's poverty maps paint an undeniable picture. Neighborhoods, once abandoned by segregation policies and waves of factory closures, now have the highest concentrations of homelessness. In towns like Saginaw and Muskegon, makeshift camps have sprung up alongside abandoned industrial areas, places that people only notice when tragedy strikes. But behind all this, there is a larger question: what drives them to this point? And why, in a country that is considered the richest in the world, are so many people struggling to simply survive? The root causes of homelessness in Michigan. At the heart of Michigan's rising homelessness crisis is a simple but devastating truth. There's not enough affordable housing left. Between 2020 and 2024, the cost of renting a one-bedroom apartment increased by 30%. Meanwhile, the median income has only inched up by 80%. This math never works out for the working poor. Working 2 full-time jobs, and still not being able to afford rent. What seems like an impossible situation is the daily reality for thousands of Michiganders. A full-time minimum wage worker earns about $21,000 a year. Meanwhile, it costs $29,520 to rent a two-bedroom apartment at a fair market rate, when rents exceed 35% of income. Eviction notices are just a matter of time. Housing experts say affordable housing construction is not keeping up with demand. In 2023, the state will build fewer than 500 new affordable housing units, while the actual need exceeds 1,200. Exacerbating the situation is the boom in rental investors who prioritize short-term profits and are willing to raise rents rather than sign long-term contracts. But rents are not the only culprit. Mental health and addiction are also the two Achilles heels of the crisis. Nearly 40% of Michigan's homeless are living with serious mental health or substance use disorders. In the past 10 years, the state has cut its public psychiatric bed capacity by 25% due to budget shortfalls, leaving many people without a place to go. When public hospitals discharge patients without a follow-up plan, many are back on the streets in just days. Former inmates also face significant obstacles to reintegrating into society. More than 15,000 people are released from Michigan prisons each year, but fewer than half have access to temporary housing or job training. Without an address, without a steady job, the likelihood of recidivism increases and homelessness becomes almost inevitable. And then there are the invisible but no less arbitrary barriers: ID, criminal records, and proof of income. Seemingly simple things are no-go tickets at many shelters. David, a recovering addict, recalls, "I had a choice, either stay in the program or get kicked out. He chose to stay, but relapsed because he had nowhere else to go." In the process of making this U.S. homeless file, we included insightful interviews with people involved, revealing how policy loopholes allow this cycle to continue. Rapid resettlement programs exist on paper, but they lack the funding to help more than a fraction of those who apply. Emergency assistance grants? Limited to $1,000, just enough to cover a month's rent in most major cities. As the film winds down, a big question arises. What kind of society are we if we let the most vulnerable fall to the bottom? Is the very system designed to protect them inadvertently pushing them aside? In the next section, we'll continue to explore Michigan's social safety net and why, despite its best efforts, it hasn't been able to keep up with the pace of the crisis. Social safety net in Michigan. Michigan's social safety net is designed, in theory, to protect the most vulnerable, but in reality, it's a patchwork of holes, a net that's fraying with each harsh winter. In Detroit and Grand Rapids and Flint and Lansing, emergency shelters are still seen as the first line of defense, but their capacity rarely keeps up with demand. In Detroit alone, more than 60% of shelter beds in 2024 were occupied by repeat visitors, leaving new arrivals without space even on the coldest nights. Winter warming centers act as makeshift relay stations, opening when temperatures drop, but forcing people to leave before dawn. Those who are not lucky enough to find a spot are forced back onto the sidewalk, waiting until it gets cold again to be allowed back in. It's not a solution, it's a vicious cycle. Housing vouchers, which are supposed to help low-income families stay afloat, come with years-long waiting lists. Only a quarter of eligible households actually receive assistance in any given year. Rapid rehousing programs are designed to get homeless people into stable housing. But budget constraints mean the support is short-lived. Many people are forced out of the program after just 6 months, even if they are not financially ready. Religious and nonprofit organizations like Commercial Off the Shelf and Southwest Solutions try to fill the gaps. Blankets, hot meals, bus passes, but they rely on volunteers and irregular donations. When budgets are tight, services are fragile. Health and social service systems are disorganized and overburdened. The average social worker has more than 40 caseloads, virtually impossible to provide real personal support. Mental health outreach teams are understaffed to reach all the shelters, and addiction treatment beds only last a few days after opening. Many mobile clinics operate on the streets, but the lack of a permanent address means many people miss appointments, fail to renew their medications, a vicious cycle that continues. A glimmer of hope emerged in early 2025, when the state launched an online portal that tracks bed availability in real time. But modern software can't make up for the shelter's aging hardware, and poor cell service in rural areas like Alpena or Marquette makes the technology useless. In these small towns, the safety net is a thread stretched to its limits. So what happens to those left behind? As the film crew's lens witnessed in Flint, a young mother left her car running all night in the cold despite the risk of carbon monoxide poisoning just to keep her baby warm. An elderly man takes shelter in a collapsing building that was once declared uninhabitable. Many others left with no choice returned to homes where they were abused, simply because there is at least a roof over their heads. The harsh reality is that safety nets as they currently exist are only temporary relief, not enough to prevent chronic homelessness. And if that net is torn beyond repair, what is needed is more than goodwill. It is a comprehensive reassessment of everything from policy to budget. In the next section, we will delve deeper into formal interventions to answer the question, can the system be rebuilt, or is it just a desperate survivalist state? Government response and policy measures. As homelessness spreads across Michigan, the state is being forced to act. Governor Gretchen Whitmer's 2023 to 2024 budget commits up to $250 million to build affordable housing, expand shelters, and support rapid rehousing programs. By declaring that housing is a human right, the state is making a clear admission that the issue can no longer be ignored. Michigan cannot build its future on empty promises, Whitmer said at a press conference in February. We will open doors, not just windows of hope. But which doors will be opened and for whom is another story. Detroit, the epicenter of the crisis, received about $90 million to renovate abandoned buildings into housing. But in smaller cities like Flint or Marquette, the allocations are largely symbolic. In Flint, the city council struggled to agree on a bond to build just 150 affordable apartments. In Grand Rapids, red tape delayed a new 200-bed shelter for months, while emergency facilities were forced to operate beyond capacity. But a new wave is brewing. Michigan has officially adopted the Housing First model, which prioritizes getting homeless people into stable housing rather than providing temporary shelter. Before providing access to support services like mental health treatment, substance abuse treatment, or job training. In Washtenaw County, pilot programs have seen a 45% reduction in the number of people living in emergency shelters, a sign that the model works when implemented properly. But expanding from a few pilot counties to all 83 counties across the state will require sustained funding and interagency coordination, something that is still fragmented. On the health and social front, some reforms have begun. The state expanded Medicaid coverage for addiction treatment and mental health services. New mobile outreach teams staffed by clinicians are authorized to prescribe medications to treat opioid use disorders on the spot. At the same time, the Department of Corrections launched a reentry housing voucher program for people released from prison, aimed at reducing recidivism and homelessness. But there are still major limitations. The $600 per month housing voucher does not cover market rent, leaving recipients at risk of eviction as soon as the voucher expires. There are also changes in the approach to law enforcement. Instead of just cracking down, some police departments are starting to work with social workers, referring homeless people to shelters and on-site support services. While this is a positive step toward decriminalizing homelessness, the results have been uneven. Many people still avoid coming forward for fear of being fined, or simply because they have lost faith. The big question is, are these commitments enough to address the scale of the crisis? The answer so far is no. Uneven implementation, large regional differences in funding, and short time frames mean that many policies only scratch the surface. If Michigan truly wants to end homelessness, measures need to go beyond pilot projects toward more comprehensive, far-reaching, and sustainable reform. And that's what we'll continue to explore in the next section, where the question is no longer what to do, but is there enough determination to do it? Comprehensive proposals for lasting change. There is no single solution to end chronic homelessness in Michigan. But if we look at the facts as this documentary shows, it's clear. We know what needs to be done. The question is whether we dare to do it. First, experts agree that the long-term supportive housing model must be scaled up. Not only does it provide a roof, but it also comes with medical services, counseling, vocational training, all under one roof. Every dollar invested in this model saves at least $1.50 USD in emergency hospital, police, and shelter costs. This is not only humane, it's also sound economics. Increasing income support is the next step. State minimum wages should be tied directly to a percentage of median rent to ensure that a hardworking person can at least put a roof over their head. A state-level income tax credit program would be a necessary cushion, protecting families from sudden financial shocks such as job loss, accidents, or illness. The private sector also needs to be part of the solution. Incentive loans or tax credits for developers building affordable housing, especially requiring that at least 20% of projects be designated for low-income residents, could mobilize millions of dollars in capital from the market. Businesses are not just job creators, they are partners in rebuilding communities. Prevention is more important than intervention. Schools, hospitals, and public services should identify families at risk of losing their homes early and activate early intervention mechanisms before they are forced to huddle in cars or shelter in cold hallways. A unified data system updated in real time and connected across organizations could become a dashboard for outreach teams to identify who needs immediate assistance. When someone is seeking shelter multiple times a month or has just been discharged from the hospital with a serious underlying condition, the system would raise a red flag. Crises, if predictable, could also be prevented. But ultimately, change will not come from the top down, it will come from the heart of the community. Local coalitions of residents, churches, businesses, and nonprofits could be the most powerful force for supportive housing in each neighborhood. When we see the faces of the people who are suffering, "Not in my backyard," turns into "What can we do for them?" And then the biggest question of all, who will be responsible when winter comes again? Implementing these proposals is not easy. It requires political will, sustainable budgets, and uncompromising cooperation across sectors and across levels. But as this film shows, homelessness is not a natural disaster. It is the result of policies, of choices, and it can be reversed by making braver choices. Change begins when we refuse to accept injustice as inevitable, when we see human dignity as non-negotiable, when you, the viewer, refuse to look away. Because sometimes, all it takes is a roof over your head to save a life. Conclusion. Michigan is at a crossroads. Either continue to patch up an overstretched and tattered safety net where more families, veterans, and children are slipping into darkness, or choose a different path, a path of rebuilding and courage, where action comes before crisis, and human dignity is the starting point of every policy. Change is no longer theoretical. It's the blueprint. Expand permanent supportive housing, increase income support, unlock responsible private capital, prioritize prevention, and harness the power of data to predict and respond. No more belated reactions. A proactive, visionary strategy for the moral and economic future of the entire state. Every roof built is a community victory. Every child educated is a demonstration of sound policy. And every dollar saved in emergency services is the clearest justification for investing in humanity from the start. The journey will certainly not be easy, but procrastination is even harder to accept. Because every winter that passes, there are more people forgotten in the cold, not because they choose to be, but because we are one step too late. As this experiential film journey comes to a close, we leave you with a question not to be answered in words, but in action. If not now, when? If not us, who will speak up, act, and make a change?